Senator from North Dakota.
In North Dakota, we've got a lot of farmers and we've got a lot of ranchers, and they're small business people. They run a small business, and they're being hit very hard by Obamacare like other small businesses across this country. A rancher from Rame contacted us. His name's Wayne, and he ranches there. You know, Rame's an area where we have a lot of cowboys, a tremendous rodeo. They compete nationally, and they have great livestock herds there. But he writes in, he says, I'm not one to get too upset about things, but this deal really has me mad. We got a letter a few weeks ago that said they were dropping our policy. I've paid my own insurance for years and years. When I got that letter, it just hit me, because somebody in Washington decided I was too stupid to figure it out if my policy was right for me or not. I don't pay a lot of attention to politics, but usually what gets decided in Washington doesn't slap you in the face like this law has with me, he says. I've gone on healthcare.gov and used the estimators they direct you to. I could be going from a $2,500 deductible to something between $10,000 and $12,000, the way it looks to me. This is going to cost me a lot more for something I don't even want. And if I could, I'd like to read just another short story from a couple in Grand Forks that got a hold of us on the marriage penalty that Obamacare creates. She writes in, my husband and I met with the primary health insurance carrier in North Dakota and were told that our current coverage under the guidelines of the Affordable Care Act will cost us at least another $400 more a month, and our deductible will increase from $2,000 to $12,000. And because we're married, we cannot choose individual plans, which would be a lower deductible. In essence, we're being punished for being married. We are looking at paying more than $1,500 a month in health care because we are only 61 years old and not eligible for Medicare for another 4 years. $18,000 a year for health care. We were told that part of the problem is the provisions in the law require us to choose a plan that has maternity benefits. How does this make sense for seniors to be forced to buy coverage that does not apply to them? We agree that benefits shouldn't be denied to people, but it's not fair to be forced to buy coverage that doesn't even apply.
Mr. President.